Hi, I'm Dr. Richard Jermyn, the Dean of Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, our Vodcast series dedicated to highlighting thought leaders who are advancing the mission of our medical school. Our mission is to foster innovation, excellence in education, and transformative healthcare practices. And with that, I have Warren Moore, Executive Vice President and Chief Operating Officer of Inspira Health. Warren has a BS in Business Management, a Master's in Health and Human Service Administration, and is a Fellow of the American College of Healthcare Executives. Warren oversees Inspira's operations and provides leadership to optimize clinical quality and patient experience across the Inspira network, hospitals, healthcare centers, and outpatient locations. Warren, thank you so much for joining us today.
Absolutely, I'm excited to be here.
I'm equally excited.
Yeah.
And my understanding is you have this expansion of your medical center into Mullica Hill.
Yeah, absolutely.
Tell us a little bit about that.
It's pretty exciting, to say the least. And what's really interesting is I joined Inspira in 2021, and the hospital was only 2 years old at the time, right? And so to imagine that we'd be here today in 2024 and already needing to expand, I don't think anybody thought that. I thought, at some point, right? But here we are. We have a host of great reasons for the project, but number one has been the demand. For the last 18 months, we've been running, there's many days when we're running 120% of our bed capacity. And that's before we get into, talking about all the exciting new programs that we're looking to build there. So it's a 5-story patient tower that adds onto the building. And at the same time, we'll be about doubling the size of our labor and delivery unit. That demand has been huge as well.
So what services will be expanding?
Yeah, so the primary there's about 4 primary purposes, if you would, for the building. It's our education program.
Which is why we're here.
Exactly, right. And so, as you know, through our partnership, we've been able to grow our residencies and our fellowships. And in fact, combined, we'll be over 300 resident slots when the year is at the end of next year. So that's a huge component of it. Most of the first floor will be teaching space and space for the residents, and as that program continues to grow.
One of the things that is particularly meaningful to me in our relationship with the medical school and with Inspira is the fact that we have shared missions. Yeah. And a big part of that is to really be in underserved communities. Very proud that we have residency programs that are really entrenched in underserved communities. As you know, we've just opened up, and our institutes will be in the Cumberland area. So very strongly academic partners with you. So I guess the question is, why this commitment to the underserved, and what can we look forward to in that regard?
Thank you for that question, right? Because as you mentioned, right, it's very real to both our organizations, that commitment, and it's very personal, I believe, to both of us as well. And so, for us, behavioral health is a huge part of our strategic plan for those communities. The tower itself, represents this huge investment that we're making in Cumberland, Salem, and Gloucester County. And as part of that, it's really about bringing services that they typically would have to travel for closer to home. As you know, in Cumberland and Salem County, transportation is a huge issue. So
Yes.
we have large swaths of the population that do not have access to transportation. And so we have to be able to provide those services in those communities. And so part of that plan as well is we're continuing to develop our ambulatory services in Cumberland and Salem County. Major investments going on there. And of course, something I know that is personal to me as well and big for our community. And I know you've spent a lot of time in this space, right, which is substance use disorder and the incredible problem for our society that's become, but in particular, in our underserved communities. So looking to build programs with you all in that area is critically important to us moving forward, as well as I said, in our expertise in the behavioral health space.
Yeah, I'm very excited to be doing that. We've been partnering in this. I can speak about this because I kind of oversaw it for
Yeah.
years. Partnering in this space with you has been a true pleasure, and I think you understand something that I try to talk about a little bit, even on a national level, is just because you build a brick and mortar doesn't mean that patients will come to you, especially from underserved populations, right?
Right.
So, any thoughts about that? Like, what do you have? And I have some ideas too that we could talk about.
Okay.
But so what? You mentioned transportation. I think that's huge, as we know, especially here. And the more rural we get, the access to transportation is little to none. But what other ideas do you have to kind of access into the vulnerable patient population?
So one is that we're building new primary care centers in those spaces, right? And so we just opened up a brand new 12,000 square foot primary care center in Millville. We had a very small site there, and it was packed every day. The demand is real, and right, so we're committing to that. However, that to your point, right? That's a building, and it's nice and it's beautiful, and we want our folks to be able to get care in state-of-the-art buildings. However, it's also part of it's the providers, right?
Yep.
So we've been able to recruit multiple primary care providers into Cumberland County, and so this will be one of those hubs we'll create for them, and we're going to be creating others in East Vineland and one in Salem as well in the near future. And what I think is exciting, if you don't mind me going on a little tangent here, right? But that's part of our partnership in the education, right, of the providers of the future. And so working with you and the other local medical schools, but really, most of our residents do come from you.
Yep.
We've been able to keep people here.
Yep.
So in our graduating class last year, we had 13 of those physicians that are staying local, right? They're either working in your programs, Virtua's programs. Many are coming to our programs. Many are going to Cooper, but they're going to be working in our communities. So that, to me, I'm so excited about that, right? Because I think growing our own here in South Jersey is critically important for us, and I'm just really proud of our ability to do that collectively.
You're talking to about 1,000 potential residents right now, listening
That's
to
true.
this.
South Jersey is a wonderful place to practice and raise your family.
It's amazing to me too, talking a little bit about residents and I looked at data recently here about who kind of stays, and there was always this idea that and it's national data that it does pan out, but if you're from South Jersey, you'll stay in South Jersey.
Right.
But what we're noticing is that somehow when our students come in here, they kind of fall in love with South Jersey.
Yeah.
So we looked even data of out-of-state students, they're staying in New Jersey. So it's very, very interesting, or at least this small tri-state area that they tend to stay here.
Right.
So to your point, there's a reason for that, I think, and it's good training and education. I think that's very, very important. So the quality of training and education needs to be there. It needs to continually move on, adapt, and grow. So, and to your point, we do fill your residency program. So very happy about that. So let's talk a little bit about patient care.
Yep.
All right. So I think the fundamental aspect of all our work is how do we improve, we talked about access a little bit, but how do we really talk about patient care? And do you look at patient care in a way different than maybe other hospital systems just because you really are in a vulnerable patient population, generally speaking?
Yes. we if we didn't, right, we wouldn't be fulfilling our mission to the community. So, we are in many ways like other health systems and in the way that we care for patients. And then there's that, the population that we have to reach in a different way.
Yep.
And so our ability to really partner in the community with all the nonprofits that support those communities and make sure that we're focusing not only on access to care, as we've talked about, but really social determinants of health, right? And we all know the things we mean by that, and in our communities, you name it, and there's a part of the population that's struggling with that, whether it's housing, food insecurity. access to mental health services, is a huge challenge. And then, quite honestly, many of them, it's the violence, right? There's a lot of violence in our communities, which I don't think people think about a rural atmosphere, and they wouldn't think that, but in the younger population. And so a lot of programming and partnerships with the prosecutor's office in the state of New Jersey and local government and Rowan, and bringing folks together and saying, how do we raise the level of support and services that are available to these communities so that we can get these kids engaged in a healthy lifestyle and make sure they have access to food and mentors and athletics. And so I know I'm all over the place on this one, but that's kind of how it is, right? There's so many needs, and it's just, let's get to the table, let's find partners, let's find solutions.
No, I mean, I think it even circles back with education, because we're looking at more and more pathways to find high school students that want to be a doctor. I tell my story all the time. I grew up in the inner city. I grew up to a single parent and never thought someone like me could go to medical school. And I, to this day, still think a guy like me, how did that ever happen?
Right.
And the reality is there's so much talent in our communities, and we have to really get in there to create people that came from this area, right, who's going to medical school. And we have to find a way, that pathway to make that happen, because they will come back to the residencies and they will service their own community. And that's what we want,
Yeah.
right? So we have a lot of work to do in that way, but we're both committed to make sure that happens.
Absolutely.
So when we talk about, this expansion that you mentioned a little bit earlier, Melika Hill, and you talked about really the experience being around the patient, that's what I heard. Did you have patients involved in sort of putting this together for you?
Yeah. We're blessed. We have a very committed, voluntary family and patient advisory council. And so there's very few things we do without getting their input. And I was blessed because I grew up as an administrator in the pediatric world, right? And so we were talking to families years and years and years ago. And I'm so glad that the vast majority now of the health system understands how important it is to really engage with your community that you're serving, and those patients and families when you're designing spaces. And so they were critically involved in it as well. They're involved. We run our policies by them, right? We want to make sure that we're thinking of the patient and their families and our communities in all that we do. And so we certainly engage them heavily in the design of the tower.
I'm going to skip back to graduate medical education. And with the expansion, very proud, to be working with you with the GME expansions and everything. What are some things we could look forward to? What can our trainees that are future trainees right now that are listening to say, hey, this is what we're doing in GME at Inspira, why you should think about coming here?
Yeah. So number one, you're going to have beautiful space to work in, right? With lots of natural light. For our folks that joined us at Melika Hill early on, right, it was never planned, and right, so they haven't had, they kind of get moved around and pushed around, but awesome dedicated learning environment, number one. Number two, we have a group of physicians that are just so passionate about teaching. And I think that's, we see that, and to your point earlier, that's why I think we're seeing more and more folks stay, right? Because the folks they've learned from, they want to work in that environment. And so you've just got an incredible group of physicians that love the experience of teaching. Most of them feel that they get more from it than they're giving to their students. It's one of those relationships that works great. And then also, we're able to start offering residencies and fellowships in more and more areas, right? We partnered on psychiatry, which was not available in this area. We have our application in for neurology. We have our application in for cardiology, right? So to begin to just have more specialties available is wonderful. And then we've also added the track for internal medicine, where you have that community primary care experience. And of course, our family medicine residents get to do that too, where they go into their hub site and they're there in the community, right, in their rotations. And so I think it's just a real commitment to making sure we provide the best possible environment with the best teachers, and really, so that our residents can have the greatest experience possible.
Yeah, and I can say that they do. And I'll put a plug in. I've worked with you guys. We started a PM&R residency.
Oh, that's right. There's
Yeah.
another new one.
Great working with you in that regard.
I think that's the only one in the area, right? I mean,
The only one in South Jersey, by far.
So that's awesome.
And I'm going to argue the best one in the tri-state area already. So it's exciting, and again, it was great working with you guys to start that, because it's a big need. A lot of our students are going into that.
Yeah.
And what's nice working, with Inspira and how you've looked at transforming graduate medical education is you said, what are our needs?
Yeah.
Right? And, and what does the community need? And I think in doing that, you made some really wise choices as you've expanded your graduate medical education.
I appreciate that.
Yeah.
We've made them, and we've made a lot of them together. So.
Yep, absolutely. And that's what makes this just a great partnership. So I'm gonna end with one general question for you. What's the future for Inspira?
Wow, that's an interesting one. I know this, right? We have a board of trustees that is 100% committed to these communities we serve. And so we will be here in these communities doing everything we can to help raise the bar for them from a health status standpoint. We'll be fighting to continue to bring federal dollars into South Jersey that we deserve here. As I think most folks know, but we'll say it for the trainees if they don't. New Jersey is one of those states that sends way more money out to the federal government than we get back. And so every opportunity we have to get it back, our president, Amy Mansu, is just, she is so passionate about that. So we'll continue to bring resources, and hopefully we'll be able to continue this journey of really growing clinicians and support service staff, right, from these communities, and raise the educational experience for these communities. And that's really what it's going to be about. Inspira is here to serve the communities, so we'll continue to grow as needed, and that commitment to that mission will always be there.
I believe that wholeheartedly. I believe that if you know who you are, you know who your mission is, the rest will always fall in. And since I've been dean, that's been my mantra.
Yeah.
And I think because of that, our research has mostly gone up. Our extramural funding has basically doubled.
Yeah.
And it's because we know who we are. And I'll kind of end with this, because I believe it wholeheartedly. Hospitals, medical schools, any business that doesn't serve the community that they live in will cease to exist. And I've seen it over and over again. So I credit you for that, and I think that's going to be the success that you're going to have, and it's going to create longevity. So thank you for coming here.
Absolutely.
Great having you talk to our viewers. I want to once again remind our viewers to please keep tuning in monthly, meet people that are helping move our mission forward, and you're going to learn a lot like you did today. I'll see you again next month. Take care.